Communication is the key in any relationship, especially between the provider and the patient. Without that good communication, that good trust, and that bond, it's going to be very difficult to care for one another. And like I said, this is going to be a team effort. This is not a one-directional thing. So it's very important that you're able to communicate your wishes, because most women have an idea and have wishes as to how they want their pregnancy and how they want their deliveries to go. And the provider, the nurse or the midwife or the doctor should be able to communicate that very clearly with you and make sure that your wishes are met if at all possible. So I think that's the most important thing, is to communication. And find out also about the setting of the practice. Are you going to be seeing 12 different doctors? Are you going to be seeing 12 different midwives? Or are there a handful that will be seeing you during the pregnancy? Who's going to be delivering you? Is there any flexibility in that? Are you set to only the doctor? Are you set only to the midwife? Do you have a choice, for example, in a multi-specialty group, that you've bonded with a particular provider? Are they willing to come in for you? Because I think that's also a really special thing, that if you've really bonded with someone, to have that person be the one to deliver you. Is that an option for you at all? Figure out where you're going to be delivering. What is the facility like? What type of services are available? I think most places are able to handle the bread and butter labor and delivery, but what kind of things are they focused on to try to ensure that your labor is pleasant, ensure that your delivery is pleasant and healthy? What kind of assistance are available do they have to help you with your recovery, help you with your breastfeeding, help you with the bonding of the baby, help you with your recovery? If you have any questions or issues, how willing are they to hear back from you? So, to get really beyond just the basic, this is what should happen, but the extra nice touches to make sure that emotionally your needs are also met. I really encourage women to come up with a birth plan, because that gives me also an understanding about what they understand and what they hope for, and try to make this everything that they're hoping that it would be, because it is a really special thing. So a typical birth plan will talk about, obviously, pain relief is a major factor for women, about interventions that they do or do not want, such as, epidurals, water labor, ambulation, ability to move about. At what point do we intervene, and what those interventions could be, like vacuums, Pitocin for augmentation induction. At what point do we become concerned and recommend these things? What are the potential risk factors that are there? And testing for the baby too. Do you want the baby to receive their standard medications immediately after delivery or not? Who's going to be there with you during your labor? Is it just going to be your partner? Will it be your expanded family? What should they expect from being in that same delivery room with you? So I think this is it's just a great opportunity for that communication to be very open.